My name is Marybeth Magtanong, and I'm going to discuss about mHealth. What is mHealth? mHealth or mobile health is a subcategory of eHealth. eHealth comprises of electronic technology that we are familiar now, like mobile phones, tablets, the internet, and social media, and using these technologies to achieve better healthcare and healthier life. The National Institute of Health Consensus Group defines mHealth as the use of mobile and wireless devices for the purpose of improving health outcomes, health services, and health research. This discussion will focus on the use of mobile devices such as cell phones, smartphones, and tablets. First, let's start with the history of mobile technology. The first truly mobile phone was introduced by Bell Labs in 1946. It allows users to place and receive calls from their automobiles. In 1959, the first car phones were introduced in the US. The early car phones were primitive and consisted of bulky vacuum tubes and relays that weighed as much as 90 pounds. Prior to 1973, mobile technology was limited to phones installed in cars, trains, and other vehicles. The first handheld mobile phone was seen in 1973, and this was the Motorola prototype. But still it is heavy and weighed about 2.5 pounds, was 10 inches long, and took 10 hours to recharge. And that 10 hours is only equivalent to 30 minutes talk time. The first generation network came in 1983, but the talk time is still the same, 30 minutes for 10 hours of charging time. The early 1990s started the 2G revolution where SMS or text messaging was introduced. The 2G mobile phones are also able to access media content, and ringtones were the first downloadable media. 2001 was the advent of 3G network, which allows for more data content and faster data transfer. This is when multi-touch interfaces emerged. 3G technology also marks the beginning of iPhone, which was released in 2007. In 2009, 4G networks came in. The 4G and 3G networks brought the smartphone technologies that we are using today. Apple Newton PDA appeared in early 1990s, but it did not make it to the masses because it was too big, slow, and heavy. The Palm Pilot was released in 1996. It was smaller and less expensive than Apple Newton. Palm Pilot became popular to medical professionals when the Hippocrates application was released in 1999. The application allows them to retrieve drug information faster using the Palm Pilot than the physician desk reference or PDR. PDAs with phone and internet access also emerged, and as wireless communication advances, convergence of technologies took place. A rapid shift from PDAs to smartphones occurred in over only 6 to 8 years. Smartphones have an operating system and is capable of executing third-party applications. Apple iPad and Android devices started to appear in 2010. Pew Research Center reported cell phone ownership among U.S. adults as of January 2014 as 90% own a cell phone, 58% have a smartphone, and 42% own a tablet. Statistics are showing that mobile technologies are well positioned to impact the delivery of healthcare services. Mobile devices are used everywhere. Physicians and patients were using mobile devices to communicate. In 2006, the World Health Organization initiated the mHealth strategy to facilitate the development of mHealth initiatives around the world. Text messaging as an mHealth intervention. Among the many features of mobile phones, text messaging has significantly helped in solving different healthcare issues worldwide. Its use for sending appointment reminders resulted in improved outpatient attendance. Patient reminders sent through text messaging improved chronic disease management for asthma, diabetes, and heart failure. Lab results notification through text messaging resulted in quicker response time for treatment or interventions. Text messaging reminders improve smoking quit rates among smokers. Patient educational programs for pregnant mothers are well received through text messages. Text messaging can also be used for emergency response and preparedness and public health alerts, to deploy health and emergency care in times of natural disaster and disease outbreak. The Department of Health and Human Services launched several Text for Health projects to support maternal and child care, smoking cessation, emergency response and preparedness, management of asthma and respiratory disease, public health, and diabetes education. Medical and health apps. Patients use smartphones and tablets to access medical and health apps. Currently, there are 100,000 mHealth apps available in the Apple App Store and Android market. Fitness apps is the largest of all mHealth apps. It is followed by medical references, wellness apps, and disease management apps. A small percentage of mHealth apps are available for accessing personal health records or PHR, continuing medical education or CMEs, diagnostics, compliance, reminders, and remote monitoring. In the disease management apps category, diabetes management apps are particularly popular. Providers use mHealth apps to look for drug information. Examples are the Hippocrates and Medscape. It is also used for calculation and diagnostics, like the Eye Examiner app, where an iPhone is used plus a hardware to take pictures of the retina. Providers also use medical apps for image viewing, monitoring, EHR access, and journal and database access. Mobile health is continuously improving and bringing healthcare services closer to every healthcare consumer. Currently, trends in mHealth are focused on the use of mHealth technologies to enhance the patient engagement and delivery of care outside of the traditional clinical setting. In the development of privacy and security measures for safeguarding protected health information or PHI, the use for disease management, for mobile EMR platforms, its use for mobile sensors or wearable technology, home-based monitoring, and reduction of healthcare costs. Because mHealth is a relatively young field, there is a paucity in the availability of clinical trials evaluating its effectiveness. Further research is needed to assess the significance of mHealth interventions in achieving healthcare quality.